You're trying to whiten your teeth, but what if the methods that you're using are actually making them worse? There's things like charcoal toothpaste or different baking soda and lemon juice hacks. Well, it turns out that some of these whitening tricks could actually be making your teeth worse. And not only that, making your teeth more yellow. So in this video, I'm gonna break down some of the biggest teeth whitening myths, why some of these don't work, and what actually does work. So make sure you stick around. Myth number one is charcoal toothpaste whitens your teeth. Look, if you use charcoal toothpaste one time, your teeth are probably gonna get whiter. Why? Well, because it's very abrasive and it'll polish your teeth really well. But it almost polishes them too well. So if you use it one time, you might notice a lot of these surface stains, like from drinking coffee or tea or other things that you're eating or drinking throughout the day are probably gonna disappear. But the problem is when you use this consistently, it can actually be so damaging to your enamel and to your gums because it is so abrasive. And what can actually happen is as you scrape off some of your enamel, which is actually what looks white on your teeth, then you get to the dentin underneath. Your dentin is more yellow, so eventually your teeth can actually start to look more yellow. Not only that, it can also damage your gums. I had a friend who decided to start using charcoal toothpaste every single day because he was really convinced it was gonna really whiten his teeth. What ended up happening was, after about 6 months, he started getting a lot of gum recession because his gums started getting eaten away by this charcoal toothpaste. And now not only are his gums receded, showing his roots, which end up looking more yellow, his teeth are a whole lot more sensitive. Because when you expose the inner layer of your tooth or you expose the root structure of your tooth, it's basically like a pathway to the nerve inside your tooth. So anything that touches it, like cold or any sweets, can make it really sensitive. Instead, you can get a regular remineralizing toothpaste that still does whitening. These are a lot safer. So things that have fluoride, or if you're not a fan of fluoride, you can use something that has hydroxyapatite. And some of the methods that they use to whiten are a lot better because they're a lot more gentle. They'll still get rid of that surface stain that you're trying to get rid of, but at the same time, they're gonna be remineralizing your teeth. In other words, they're gonna be strengthening. They're gonna be adding minerals. So if you polish some of your teeth away, they're gonna be adding minerals at the same time to keep them strong. But this actually brings us to myth number two, which is teeth whitening toothpaste work the same as teeth bleaching. All these whitening toothpaste really do is remove the surface stains on your teeth. They don't actually go deep down and whiten your teeth like teeth bleaching does. So you know, like those Crest whitening strips, or when you go to your dental office to actually get your teeth whitened, that's actually bleaching your teeth because those chemicals in it are penetrating your enamel and actually changing the molecular structure of those stains to make it look more white. But what these whitening toothpastes are doing is just polishing your teeth. Kind of like when you go for your cleaning and then at the end of the cleaning they polish your teeth just to basically get rid of any surface stains. So these toothpastes are really good for things like if you've been drinking coffee or tea a lot, or if you're drinking wine or have any stains on your teeth built up from eating different foods, they're really good at polishing those off. And this is also what you get polished off when you go to your cleanings. But if you want to make a drastic difference in how white your teeth look, then these whitening toothpaste probably aren't going to do it. So what you'd really want to do is combine this whitening toothpaste with some professional treatment. Now, by professional treatment, I don't mean you have to go to a dentist office. You can go to a dentist office and get your teeth whitened there, but you can also do things at home. There's plenty of different products out there that can whiten your teeth, and there's really one of two main ingredients that can whiten your teeth. So it's either going to be hydrogen peroxide or carbamide peroxide. These are those chemicals that are going to go inside your teeth and change that molecular structure of those stains. Myth number three is that lemon juice and baking soda are natural teeth whiteners. Look, I don't know how this myth got so popular or why so many people tried doing this because it literally makes no sense. Lemon juice is very acidic, and acid is terrible for our teeth because acidic things will destroy our enamel and eventually make our teeth look more yellow because you're exposing that dentin that is inside of our teeth, and that dentin is very yellow. And now if you combine this with baking soda, that's even worse because baking soda is very abrasive. We talked about with charcoal, how charcoal is very abrasive for our teeth and can also destroy our enamel. Well, baking soda can essentially do the same thing. Now, if you combine this with something that's very acidic, like lemon juice, now you're basically destroying our enamel, weakening your enamel, so it's easier to get demineralized or weakened, and then you're combining a very abrasive thing like baking soda that's going to scrub away this enamel even harder, then over time you can probably see how this is really damaging to your teeth and can probably make them look more yellow. So look, if you try to use this baking soda technique once in a while, it's probably not going to hurt. But I would never recommend putting lemon juice on your teeth. If you're going to go that route, it's much safer and much better to just use the professional and normal teeth whitening strips or professional treatments. Myth number 4 is that teeth whitening damages your teeth permanently. Look, is it true that teeth whitening strips or teeth whitening products can damage your enamel? Yes, but it's actually very unlikely, especially if you do it correctly. When whitening products are used correctly, they do not cause harm to your teeth, but they might cause them to become sensitive. Sometimes people are prone to getting more sensitive teeth, and sometimes people just react differently. The reason your teeth can get sensitive after whitening is because as those chemicals will start to penetrate your enamel, they're temporarily exposing that dentin or that inner layer of your tooth. So in other words, your teeth are getting a little bit more porous at this time. And your dentin is basically a channel to the nerve inside your teeth. So once your dentin is exposed, anything cold or any other stimulus can basically send a shock to your nerve and can be really sensitive. That being said, it also depends on the concentration, because if things have a higher percentage or more of this hydrogen or carbamide peroxide, then it can be more damaging if you leave it on for too long, especially if it touches your gums, because your gums can get really irritated at higher concentrations of this stuff. And if you keep using this incorrectly and keep scrubbing it on your gums, then you can start to get this gum recession where your gums start to get pulled back because they keep getting so irritated. But if you use these products correctly, then you shouldn't really be getting them on your gums, and your teeth should be fine. Now, I would recommend using a sensitivity type toothpaste before and after whitening, something that has potassium nitrate in it, because this is basically something that can block those nerve endings and basically plug up those exposed dentin fibers and prevent you from feeling the sensitivity. Now, myth number 5 is the stronger the whitening product, the better. This is a really common misconception because a lot of people think it's better to get their teeth whitened in a dental office rather than just doing it at home because there's a higher concentration in a dental office, so my teeth will get more white. What the real difference here is how fast you're gonna get your results. So if you use a higher concentration, then you obviously don't need to spend that long to get your teeth as white. Versus if you use a lower concentration, like these whitening products that you use at home, then you'll probably have to use them a lot longer and more often. You just gotta keep in mind though, if you use a higher concentration, then it's more likely to damage your enamel or your gums if you use them incorrectly. This is why it's required to go to a dental office to use certain concentrations of hydrogen and carbamide peroxide. The other thing with using a higher concentration, like going to a dental office, is you're probably gonna have more sensitivity. It's pretty much common sense. More concentration, you're gonna have more sensitivity. If you use a lower concentration, you're gonna have less sensitivity. So what I'd recommend is if you don't wanna go to a professional setting and get it done, you can do it at home. You're probably gonna wanna use a lower concentration, but just do it like once every week and just keep tracking your results. You're gonna wanna take pictures from before when you start in very similar lighting and keep taking pictures as you track your progress. Because what might happen is a month down the road, you might think, well, my teeth didn't get any whiter. But then you look at these pictures from a month ago and you think, well, heck yeah, my teeth got a lot whiter. But that's why you want to use similar lighting, because lighting can really throw off how white your teeth look. If you take one picture outside in the daylight and take the other picture as like a selfie in your bedroom, that's not gonna be a really good comparison. You also wanna track how sensitive you're feeling and making sure you're not causing any damage to your gums. So this is why it's important to make sure you keep going to your dentist every 6 months, talk to them about what you're doing so that they can check and see if there's any changes going on. But from what I've seen, if you do it like this, if you just do it like once a week and do it for a long period of time, you can get really white, nice looking teeth and not have any of the other complications. So thank you guys for watching. If you learned something new about teeth whitening, make sure you hit that thumbs up button, subscribe to my channel below and leave a comment. And as always, I'll see you in the next video. Would you go to bed with a layer of bacteria and acid eating away at your teeth? Well, that's exactly what you're doing when you don't brush your teeth at night. When you sleep, your mouth becomes a breeding ground for these harmful bacteria. And this will increase your risk of getting cavities, gum disease, and even waking up with bad breath. But this goes beyond just affecting your teeth. Neglecting your